Hello, are you looking for a getaway inside the body? If so, you've come to the right place. I'm Joey Green, co-founder of Just Breathe Tours, and I'm here to tell you about our new tour through the respiratory system.
We will begin with the upper respiratory tract.
After entering through the nasal cavity, you will first pass through the pharynx. The job of the pharynx is to moisten and filter air before it hits the epiglottis. The epiglottis will open to allow airflow into the trachea and stop air from entering the esophagus. After passing the epiglottis, you will enter a space called the larynx, which houses the vocal cords. Passing through the vocal cords and entering the trachea, you will see that the tracheal walls are made of C-shaped cartilage, which helps the air passageway to be flexible but strong to endure a lot of pressure.
Now we have the lower respiratory tract.
Once inside the trachea, you will reach the point where it branches into the right and left primary bronchi. Each bronchi leads to a lung, respectively. Once inside the lungs, the bronchi split into bronchioles, which ensure that incoming air is supplied to the alveoli. The alveoli are small sacs that inflate and deflate as air enters and exits the lungs.
Every time that you light up a cigarette, you are saying that your life isn't worth living.
One of the major hazards that affects the respiratory process is smoke inhalation. The effects of tobacco smoke on the respiratory system include irritation and deterioration of the trachea and larynx, reduced lung function, and excess mucus in the lung passages. Smoking drastically decreases the size and function of the lungs and trachea, often leading to respiratory failures.
Now we'll move to the ribs and diaphragm.
As air enters and leaves through the respiratory tract, the lungs expand and contract with the help of the ribs and intercostal muscles. The rib cage also plays a major role in protecting the lungs and heart. Each time a breath is taken, the diaphragm expands downward towards the abdominal cavity to open up the chest cavity so the lungs can expand. Then, snapping back up like a rubber band, the diaphragm pushes the air back through the lungs and out of the body.
Your final experience will be gas exchange.
Surrounding the alveoli are tiny blood vessels called capillaries. Between these two structures is where the exchange of oxygen and carbon dioxide happen. Oxygen enters into the capillaries and is then transported throughout the body via the blood. While oxygen is entering the blood, carbon dioxide is also passing from the capillaries into the alveoli to be exhaled back through the respiratory tract and out the nose or mouth. Does all of this sound like fun? If so, please contact Joey and Kelly at 618-BREATHE or www.justbreathe.com. And remember, always just breathe.